Hello everyone, welcome back to the Anatomy Lab. Today we're going to take a look at the leg, ankle, and foot. And to be clear, when I say leg, what I'm talking about is from the knee to the ankle. So the thigh is also part of the lower extremity, but the leg is referring to from the knee to the ankle. So in the knee, or from the knee to the ankle, you're going to find two bones in the leg, the tibia and the fibula. But in addition to that, from the leg downward, you'll find the ankle bones as well as the foot and toe bones. So we'll talk about that in just a little bit. Let's start off by taking a look at the tibia. So this is the tibia. The tibia is one of the strongest bones, and it is one of the bones that you have to put all of your weight onto essentially. This is going to be in the leg, and it is going to be very strong and sturdy. As you can see, it's very wide and very structurally sound. So this is not going to be broken very easily. In fact, you probably hit it multiple times throughout your life. So let's take a look at the landmarks that we have here. So first of all, a good thing that you want to look for are landmarks that are going to tell you anterior and posterior, medial and lateral, superior and inferior, or proximal and distal rather. So there's one or a couple that I'll look for, but there's also one that is absent that helps me to identify it as well. So do you see a ball end on this bone? If the answer is no, then it's likely not the humerus or the femur. So in this case, this is definitely the tibia. But another thing that I'll look for is this over here. This is called the medial malleolus. So the medial malleolus is going to tell me two things. This is distal, and this is the medial side, meaning that this is lateral and medial, proximal and distal. And now the only thing I need to figure out is which side is anterior and posterior. But let's go to that, or let's figure that out later. Let's take a look at what else we have here. If this is the medial malleolus, on the other side of the distal tibia, you'll find this kind of depression in here. This is called the fibular notch. This is where the other leg bone is going to be able to fit and articulate with it a bit, but this is going to be a kind of broad depression on the lateral side of the tibia. So medial malleolus, fibular notch. Now moving to the proximal side, you have these two kind of broad regions over here. These two broad regions that are going to be articulating with the femur are called condyles. But you have a medial and a lateral condyle. Which one is which? So to help with orienting yourself, what was the structure that helped you to identify medial versus lateral? You have the medial malleolus on this side, meaning that this is the whole medial side of the bone, and this is the medial condyle. And what that means is that this on the other side is the lateral condyle. So medial condyle, lateral condyle. Moving to the anterior side of the tibia, this is the tibial tuberosity. You can see that you have this kind of roughened region protruding outward. If you want, try to feel this on yourself right underneath the kneecap. You should be able to feel kind of a large roughened bump underneath the kneecap. This is the tibial tuberosity. And while I'm on it, you can also feel this. Feel for the medial side of your ankle. You'll feel a large bump on like the medial side towards your ankle region. Guess what this is, or guess what that is. So I always wondered what that was like throughout my life. Like, why is there this big bump sticking out from my ankle? Thanks, tibia. Now, there's only a few more things to take a look at here really quickly. This kind of large eminence from the anterior side of the bone, this is called the anterior border. So this large ridge might look familiar, it might feel familiar. This is the anterior border, which is essentially your shin. So what you know as your shin, if you feel this part of the bone and then feel your shin, you should see that they're very similar. They're essentially the same thing. So what you've been hitting your whole life is your anterior border of the tibia. Now, like we said, we want to be able to orient ourselves. Like, we want to ask, is this a left or a right tibia? So to do that, anterior and posterior, medial and lateral, proximal and distal. Like, let's take a look. So medial malleolus tells us distal, proximal, medial, lateral. But now which side is anterior and which side is posterior? So either of these two good ones, tibial tuberosity, definitely anterior side, meaning that this is anterior. And now I can kind of think about this. This is the front, this is the back. This is going to be the medial versus lateral side and proximal versus distal. So if you're not good at kind of imagining what direction it should be, try to imagine it in yourself. So looking at it from the back, I'll hold it like this. Sorry, it's hard to see on this angle, but you can hold it like this. This is going to be a left tibia. That means that this is medial. This is the back, and this is going to fit into my left leg. Now, the tibia is not the only bone in your leg, though. Remember that you also have this other long bone. So this is not really a weight-bearing bone. This is going to help the tibia, but really the strength comes from the tibia. This is the fibula. And unfortunately, the fibula is one of the least kind of unique bones. It kind of is just like really long and skinny, which I guess is kind of unique in itself, but like you really kind of might need to use elimination for the fibula. But the fibula also has a couple of landmarks that you can look for as well, like essentially the head of the fibula or the lateral malleolus. So the more distinct of the two is this side. This, if you look closely, you can kind of see that you have this pointed region right here. This is going to be helping you to identify the lateral malleolus. But on this side, it's more kind of like flatter. This is going to be the head of the fibula. Now, in addition to the leg bones, you also have the foot and ankle bones. So this is the foot, the ankle, and the toes. And if you are familiar with the fingers, like you may see a similar type of organization. So down here, you have a group of bones that make up the ankle bones. These are called the tarsals. So all of these bones are the tarsal bones. So excluding these long bones, these are tarsals. But there's actually two tarsals that you need to know specifically by name, and that is going to be the two largest of the tarsals. So first, you can see that you have this big old chunky guy back here. This is the very back, the very bottom of your foot. This is called your heel bone, otherwise known as your calcaneus. So calcaneus, and then over here, this is called the talus. So the talus is going to be articulating with the tibia, and it is going to be at the very top, the second largest of your ankle bones. So talus and calcaneus are part of the tarsals, and then these are all tarsals collectively. Moving away from the tarsals, you then have metatarsals. So tarsals, metatarsals that are going to be going out and throughout your foot. And then lastly, you have your toes. So your toes are otherwise known as phalanges, but for the foot and your toes, remember, you need to say phalanges of the foot, because these do not belong on the hand. These are toes. You don't want your toes on your fingers. Like that will not make sense. So these are the phalanges of the foot. But something that you will also see is that you have different kind of like segments of your toes. So similar to how you had your fingers with 3 segments, the majority of your toes also have 3 segments. So let's take a look at this toe right here. You have 3 segments, 1, 2, and 3. This is called the proximal phalanx, the middle phalanx, and the distal phalanx. So those are going to be the same type of organization for toes 2, 3, 4, and 5. But the first toe, your big toe, only has 2 segments. So that is going to be your proximal phalanx and your distal phalanx. So proximal phalanx, distal phalanx of your big toe. And your big toe also has a special name, which is your hallux. So hallux, big toe, the rest of them have 3 segments. Now, one more thing regarding your phalanges is that you need to name them properly as well, or you need to number them properly as well. So to go back to maybe this toe, what is this one? So this is the proximal phalanx, but what number is it? 3. So proximal phalanx of third toe of the foot. So proximal phalanx 3 of the foot. And you can do that for all of them. So just make sure you're being careful and naming them appropriately. Otherwise, we don't know if they're fingers, toes, which segment they are. And that's really important in identifying things effectively. So with that said, I believe that's it for the leg, ankle, foot, and toes. Keep up with the studying. I know that there's a lot of bones, but you can definitely do this. Just make sure you continue to practice using your structure list as well as the pictures that are provided and these videos. So good luck. Thanks for watching, and I'll talk to you all again soon.